Hi, I'm Judy Nyman. On behalf of the Forum for Healthcare Strategists, as well as our colleagues at Monigle, welcome and thank you for joining us for Saving Healthcare with the Neighborhood Hospital, innovating through design, experience, and messaging. In today's webinar, you'll hear about Catholic Health's 3-year journey to create a sustainable and operationally viable neighborhood hospital model for its community. Our speakers will share the challenges, the triumphs, and the lessons learned over the course of this transformative experience. Before I turn the program over to our speakers, one quick note. Attendees are participating in listen-only mode, but you can still ask questions. If you have a question, please enter it into the question and answer pane located on the bottom of your screen at any time. Our speakers will respond to as many questions as they can get to in the time that we have. With that, it's my pleasure to turn the program over to Dave Middendorf, who is the Executive Director of Health, Care, and Wellness at Monigle, and who will be leading today's discussion. Dave?
Thanks, Judy, and thanks everyone for being here. I would just like to really quickly introduce our other folks that you're going to be hearing from today. We've got our good friends from Catholic Health of Buffalo. You have Joyce Markowitz, the CEO and president, as well as CJ Erlab, who heads up strategic growth and partnerships. You also have Allison Moore from our team, who leads our experience design discipline. So a lot of great information that they're going to share, and just want to kind of orient you to some of the slides that you'll see today. It's not a traditional PowerPoint presentation. A lot of what you'll see is imagery and video and kind of just reference points from this 3-year journey that we've taken together to build this neighborhood hospital and save healthcare for a region. This has been a really exciting project for us because there's certainly no shortage of challenges in the healthcare space. They seem to be growing every day, but it's really exciting to be able to talk about actual solutions. And these honestly weren't easy solutions. And I think what you'll get to see is, all that it took to get this innovation built and to really change the way that not only healthcare was delivered, but how healthcare was operated, and the great work that Joyce and CJ did to get there. With that, I really want to turn this over to the people who can really tell the story. Like we said, this was a 3-year journey, and both Joyce and CJ were there from the very beginning of this effort, really shepherding it since day one. So I'd love for Joyce and CJ just to give us a little bit, give us a little bit of background. What's the lay of the land, and what was the context that you were entering into in this work?
Thanks, Dave. We're thrilled to be with all of you today. Let me orient you a little bit to this slide here. We are not a suburb of New York City. We are about 8 hours away as a drive. Western New York is made up of 8 counties, and it has about 1.2 million population. But where we're really focusing, and these shots are from, is from Lockport. It's in the Niagara County. There's about 200,000 patients, people, residents in Niagara County. Catholic Health has a hospital in Niagara County, but it's up in the northwestern corner of Niagara County, just past Niagara Falls. And actually, I used to be able to see Toronto from my office right across the lake there. The county, though, takes about an hour on county roads, back roads, and I wasn't doing the speed limit to get from one end of the county to the other. Lockport is right in the middle, and I think the geography was important and will play into why we thought this was necessary to try to help this community.
Joyce, do you want to talk a little bit about kind of the context and what was happening with this hospital?
Yeah, I would love to. So the hospital that was located in Lockport was not part of our health system. It was called Eastern Niagara Hospital, and hospital was old. It had been there for many, many years, was over 100 beds. and had really had a lot of challenges through the years financially. It actually had a secondary hospital that was part of their network, and they sold that hospital off, hoping that if they just had the one that they could make things work. The pandemic obviously did not help. It put a tremendous amount of strain and burden. And what the community was finding is even the quality of the care that was being delivered was starting to diminish, and less people were going to access care there. So they were either going to the hospital that CJ described, which was up further north towards the border, or they were coming into Erie County. And then we learned that they were not going to be able to remain in business, that they were going to go bankrupt. And they started reaching out to say, you know, is there anything you can do to help us? The reality is that we did not want to take that hospital over because of the age of the physical plant. And it was just too big for the community. But we also knew there were approximately 80,000 people living in this area that were going to have to drive, you know, 45, 50 minutes to get to the nearest emergency room. In addition to this, the ambulance service that's available in this community is primarily volunteer ambulance. So think about that. Think about somebody, you know, calling in and they have chest pain, and the ambulance has to come, and that might take 20, 30 minutes to get there. And then you've got to drive another 40, 45 minutes. And that's in good weather, because remember, we're outside of Buffalo, and everybody knows that Buffalo equals snow. So it, you know, you could be having chest pain and not actually get to the emergency room for well over an hour. That did not sit well with us as an organization. And we really felt that we needed to do something to support this community and provide them with some level of high quality care. Also, because of the fact that we are a health system and we offer, we have a tertiary hospital that does heads and hearts. We have the hospital that was up in Niagara County. We have surrounding hospitals that specialize in orthopedics. We have outpatient ambulatory surgery, home care, nursing homes. We really felt that if we could take all that we had to offer and really wrap it around this community and provide an experience that was exceptional, that we could deliver healthcare to this community and allow those people to stay within the Niagara County and not have to come into Erie County to receive care.
Can you talk a little bit about the way you came up with the solution, right? There was clearly a huge set of challenges, but what got you to the ultimate solution that you came up with?
You know, I think we tapped into a lot of people that we knew we weren't sure what we were building. We knew we were going to build something, but we weren't quite sure what we were going to build. We also really wanted to make sure that for the most part, the individuals remained within their community. So we looked at what was missing in the community, and one of the big areas was specialists. There was very few specialists in the community. So many people do come in to Erie County in order to get care. So we knew that whatever we did, we were going to bring specialists into the community, and we were going to try to care for people in the area in which they lived. But we also knew we could not be all things to all people. We couldn't replicate what was there because it didn't work. And just because we built a new building didn't mean it was going to work. It had to be the right size and have the right services available. So we started to really explore what was happening across the country. What were other people doing? What were other more rural communities doing? And we came across through actually perusing through LinkedIn, looking at different hospital systems, started having phone calls with folks and learning about micro hospitals. And what's interesting in it, New York State does not recognize that terminology. But we knew that that was probably what we needed to build, was a smaller footprint with everything that someone would need, with the exception of an ICU and inpatient surgical. And so we spent some time in Pennsylvania with the Allegheny Health System. We talked to St. Francis Healthcare out in Indiana. And we came up with this concept of building this smaller footprint hospital. But the other piece I think that was really important to us is we had just gone on Epic. And we really wanted to think about how could we utilize the tools that were built in Epic and make this facility to be very high touch, but also very high tech, and do it in a way that we could save money, work to have our associates working at the very top of their license, but allow patients to have an exceptional experience when they came through our door. And that was really an important goal for us. But in order to accomplish that, we had to get our current team to think very, very differently. So we put together a vision, and then we shared that vision with New York State, and said, look, we're willing to go in, we're willing to do this, but we need your support as well. We need you to be by our side. And we explained what we were going to try to build, and we settled on the name, the Neighborhood Hospital. And the state really loved it. But in New York State, as in many other states, when you're going to build something of this magnitude, the expectation is that you get your identify your land, you do your drawings, everything has to get submitted, and that process alone generally takes over a year. And we said to New York State, look, this place is going under. We don't have a year. This community is going to be without services. So how can we work together in a collaborative way so that we can get things moving? And for the first time in, over 35 years working in this community, and in New York State, for the first time ever, the state said, we'll work right beside you. And so we had weekly phone calls, and we handed in drawings, and we handed in, the electrical drawing and the plumbing, and all of it we did separately. We didn't have to pull it all together in a year. And the architectural team from the state worked side by side with us. So they allowed us to break ground even before we had all of the drawings and everything in place. It was really, they allowed us to break ground on a concept, which was something that I had never experienced before.
I think it's a monumental feat to get the entire state of New York to align to the need. And you probably do a whole webinar just on that. But what about the internal side of the story? CJ, maybe you can talk a little bit about how did you get the actual organization on board and get your own team to invest so much in this?
Well, of course, we started with the financials and built a pro forma. We had to look to see that this was really the word that keeps coming back, sustainable. We were not going to move into that community, promise a whole bunch of stuff if we couldn't deliver. So we started with the pro forma, but then we also had to, I think this is important, we had to get the managers and the directors of Mount St. Mary's, which again is up in the upper left-hand corner of Niagara County, excited about this, because we all have needs for capital. We all want new things. Why in the world would we invest in a whole community that we weren't in? And so spent a lot of time helping the managers and the physicians understand that we were there for the Niagara County community, and it wasn't just surrounding immediately of Mount St. Mary's. So we started to think bigger. We realized that we could make an impact across our whole county. And then I think the other thing that was really key for us is we started weekly meetings. We got a core group together, and that was made up of people at the senior levels of the system, not just our small Mount St. Mary's Hospital. So we had information systems technology representatives, planning, operational people, both from the system and from our hospital in Niagara County. We had the architects on board. Also, Joyce mentioned that this hospital, Eastern Niagara, was going out of business. So we also included them on the build so we could figure out their timing, how could we help them? Because the last thing we wanted is for them to shut down before we were open and could provide continuing service to the community. We also had HR on board. We are, Western New York has a lot of unions. And so we needed to work with a couple different unions and establish all of that. And then, of course, we had our public relations and marketing and communications folks. Another important point that I would bring up that I think helped us a lot, we had a technology called Confluence and Jira. So all of our material we would put into Jira. And as people were working on it, throughout the week. They would be entering into JIRA. And then when we would have our weekly calls, we would actually have someone that was very good in JIRA and Confluence, and they would run through the updates so everybody could see them, they could find it. And that was sort of the cadence and pace of our meetings. And then really what I think helped as well is we were during this time fighting COVID, and people were really stressed and woe is us and how are we going to get through this. And I think this opportunity allowed people to focus on reinvestment and growth, and there's going to be a future for us, and we can really make a difference and come out of almost like a phoenix coming out of this really challenging time with COVID. So we started to get the whole organization kind of excited about this vision.
Yeah, and what made this really exciting is, I mean, almost daily in my line of work, I'm having these conversations with prospective clients, running workshops, completing projects, all around this theme of like innovation. How can we build something new? What is the future of this? The challenge that we also hit daily is the follow through. So even before we had started this project with Catholic Health Buffalo, we were able to kind of see as we were having these scoping conversation that there was something a little different here. There was uniform kind of leadership vision with Joyce and CJ already at the table, that they had brought a cross-functional team in for support around this project. So we could kind of see that there was already this expectation for follow through from the very beginning that really signaled to us that this was real and they were really looking to do things different.
Yeah, speaking about different, as you can see, you're starting to get to see some of the actual construction and what was happening with getting this hospital built. But Joyce, maybe you could quickly talk a little bit about what the model actually looked like, what the model, the operations, and how to make this neighborhood hospital work was different than normal operating.
So, you know, when CJ talked about the group that met every Thursday, that is the group that actually designed really the layout of what the hospital would be, what was important. We knew, for example, that we wanted the community to come to this site and utilize this site, not just for medical care, but as a place, a gathering site. So we knew that a community room in the very beginning or the very front of the hospital was going to be extremely important. We also knew that we were going to bring these specialists in and that we were going to have primary care on the location as well. And so how that looked was going to be really important because we didn't want people to think, oh, I've got to go to the hospital to see my doctor. So it was positioned differently. But what was most interesting is people know what they know, right? So you would talk to the pharmacist and the pharmacist would say, oh, I need X amount of square feet because, you know, it's got to meet, you know, USP 800 or 9, wherever we are now. I don't know if we're 900, whatever it is. It's got to meet this standard. It's got to meet that standard. And I would push back and say, no, that's not the way we're going to deliver that care. We're going to deliver it differently. So this is what we're going to do. And he would push back and say, oh, no, we can't do that. That's illegal. That's this. And there were times that people pushed so hard wanting to do things exactly the way that they already did it, that I would say to them, would you feel better if I got a legal opinion on this? And I would go to our outside legal, I wouldn't even use our own, but our outside legal counsel and have them write a paper to basically say, here's what the regulations read. And the way we're designing this falls within the regulations. We are not violating any laws. And sometimes it took that to move somebody within the group forward that they would feel comfortable. And so rather than challenging your coworkers, we would just take a different approach with it and say, here, let me get you the information. So when we were designing the hospital, we talk about wanting nurses to work at the top of their licensure. It was really important to us that the individuals that we hired to work here had the same mindset that we really wanted for the vision of this building. We wanted that patient to come in and feel welcome the moment they walk through the door. We wanted individuals that it wasn't just about skill, it was about personality. It was the way they would outreach to our patients, that there was less hierarchy. So think about, the emergency room gets a little bit backed up. The doctor says this patient's ready for discharge, but the nurses are busy with other patients. Why can't the doctor pull the IV and do the discharge paperwork? So we wanted to create a very different type of environment. What's really unique about our space is we are only a 10-bed hospital, so we have 10 inpatient beds. But our nurses, depending on which day of the week and where we need the help, some will work in the ED on Monday and Tuesday, but when they come in on Wednesday, they take care of the patients on the inpatient side. So they're not hired for very specific things. They are hired to care for the patients within the walls of this hospital. So we spent a lot of time researching scope of practice regarding respiratory therapy. So for example, we don't have a full-time respiratory therapist in the building. Our nurses actually provide respiratory treatments. They will put patients on CPAP or BiPAP. But if a patient needs to be intubated, that's obviously done by the physicians or nurse practitioners that are there. And generally, if somebody is that ill, they're getting transported. So we really thought even about the way we draw labs. We use a lot of point of care testing in this building. Even though we do have a small lab in the building, we're using a lot of point of care testing. Same thing with, again, with pharmacy, where we use Pyxis. We do have a medication room, and we do have a hood in case we have drugs that have to be mixed in the hood. But again, it's not a full-blown pharmacy. So it was set up so that we could truly meet the needs of that emergency room patient or that inpatient, but not necessarily the way we do it at one of our larger facilities.
I think it's so interesting, all the different challenges that you've had to overcome just to get this thing built. But then, at some point you recognize a different set of challenges that, weren't related to design and construction. CJ, do you want to talk a little bit about those challenges?
Sure, Dave. Joyce mentioned that the facility's 10 beds. Well, the community knew their hospital was 120 beds, and they just could not wrap their head around the fact that this community didn't need a replacement hospital, or why weren't we just taking over Eastern Niagara and keeping all 120 beds, there. And because it was only 10 beds, well, then they immediately, and I used to get pushback all the time, well, this is only going to be a glorified urgent care. The other thing that was complicating is that while Catholic Health is known in Western New York, we really weren't known for that community. We had a small primary care practice there, but for the most part, we were on the west side, as I shared with you, and there's not a lot of travel back and forth between east and west side. The other thing that was coming up often was there was real anger in the fact that Eastern Niagara had gone through all of its cuts of service, and we started getting linked in with that. So we were taking some of the hits and some of the anger in the community, not just why aren't you taking him over, but why did you do this? And we had to say, we weren't doing this. The other thing that Joyce talked about is all of those changes where people were doing multiple roles, or were not getting on board with, yes, we can do this differently. There was a lot of employee resistance. I don't know if they were scared of change, scared of the unknown, but that was really problematic. And we kept reinforcing we have to do things differently because the way it was done was unsuccessful. They went bankrupt, and we're not able to just take that on and do something that's such a significant financial deficit. So as you can imagine, with all of those challenges, we're regularly trying to communicate. And what I was finding myself really struggling is I would try to tell the story. I'd try to respond in the moment that this wasn't an urgent care and it was going to have ERs and it was going to have inpatient beds. Well, what was clear is, while I may have been doing a message that varied to the audience, Joyce was also talking to people. The folks that were on that weekly call, they were trying to talk to people. And we had really quite a number of different messages that were going out. While a common thread, they weren't always common. So I think that was a huge challenge.
So what was the rationale for, bringing in outside help to start to address some of these challenges?
Obviously we're a large health system and we have a marketing and public relations department. But what was really important to me is exactly what CJ talked about. We had a vision, and it was our job, the two of us, to create that vision. And we were struggling with that because we needed to find some kind of common ground. And I'll be honest with you, I started Googling, who can help us to create a vision. And I came across Monigle, and I started watching some YouTube videos of some of the really neat things that Monigle had done with other health systems. And I thought, you know what, this is exactly what we need. These folks can take a concept and a vision that someone has, and they can help you to communicate it and bring it to life. So we had a phone call, started sharing information, and every phone call I felt it was better and better because the team really understood what it was we were trying to accomplish. And I think really what did it for me was we knew that we needed to have a statement that spoke to what we were doing, so that whether we were at a farmer's market or we were meeting with EMS, or CJ and I, the people in Niagara County, like the radio. We were on the radio all the time on radio shows, but we just needed that clear messaging. And CJ is not kidding when he talks about the first thing that would come out of everyone's mouth is, how can it possibly be a 10-bed hospital? But we had done our due diligence. We had looked at the community. But the other thing we did is we sat down and actually went right to the DRG level to say, this is the kind of patient that will be cared for on this campus. This is the type of patient that needs to go here because of an ICU, or needs to go over here, or needs to go outpatient. So we knew exactly the type of patient we would be caring for at that site. And the only thing we had was a little variability between 10 and 20 beds. So we started off with the 10 beds. And I think part of what we did to accommodate the question of why just 10 beds is we let people know that we could actually have 20 beds if they were double rooms. So we did double head walls. But the other thing we did is, hidden in this building, we have space that it was created that if we needed to put 10 more rooms in this building, it could be done very, very quickly. So we have hidden shell space in the building. That brought some relief to people. But up until this point, we haven't needed to do that. But the team from Monigle, we brought our physicians, we brought our leadership from our organization, we brought people from our work group, and Allison conducted an exercise with us. And really, we came up with what's important, what are we trying to build, and we got everyone's vision. And then we sort of had it all aligned then what the original vision was. And that to me was like the start of it all, that we really were able to then begin to communicate much more effectively with anyone we came in contact with, because we were all singing out of the same book, and it was and we all knew the words, which was great, but the engagement with Monigle was different than the work that our PR folks and marketing folks were doing. And that group was hard to convince because they kept saying, no, we can do this, we could do this. But it was beyond what they do on a daily basis. It was something very unique.
And it was so fun for us, jumping into this, early on, and what early on in the communications challenge piece, because there's so much effort had been put into what was actually getting built and what the services were going to be like. And Joyce said it. We did a lot of listening, right? We went out and we talked to people in Lockport. We talked to business leaders. We talked to folks who were operating the hospital that was closing and kind of what their vision was for what new hospital was being built and what part they might play in it. So a lot of internal and external stakeholders and really helped us start to understand the context of what was happening and the different things that we needed to be able to address in the story that we were going to tell. One of the biggest challenges was that people didn't really know Catholic health in the region. So we needed to connect some sort of why. Why is Catholic health the one coming in and being the ones that are going to essentially be someone that you can trust to deliver a solution that's going to work for you? At the same time, we're introducing an entirely new model of care that these folks weren't used to. They were used to the traditional big hospital. It looked big. It had a lot of floors. It obviously should have a lot of services in it. But that's not how modern healthcare worked. And that wasn't sustainable. So we needed to start reorienting people to the idea of an ecosystem of care and all the different parts and pieces that Catholic Health was bringing to the table to keep them out of the hospital, right? In the first place, keep them healthy, keep them supported, take care of them at home, transfer them if they needed to be transferred. And then ultimately really feeling like we're woven into the community and making this hospital feel like it was Lockport's. It wasn't something that was just being plopped down like a cookie cutter into their neighborhood, but really something that they could be have pride in and feel like it was a part of the community itself. So those are the kind of the challenges that we wanted to solve for, and ultimately developed a story, a value proposition of sorts, and supporting language that gave Joyce and CJ and the team that that consistent place to actually tell the story from. So Joyce, would you want to read our story?
Absolutely. Where there is a need, we find a way. Together with the people of Lockport, we are pioneering a new era of modern healthcare that our community can rely on. The Lockport Medical Campus is more than a hospital. It's an investment strategically designed to bring emergency, inpatient, and specialty care to a single convenient location that means you and your family can stay close to home. It's an innovation hub where care teams collaborate and take action, quickly getting you the world-class medical attention that you deserve. Above all, Catholic Health and the Lockport Memorial Hospital are catalysts for building a stronger and healthier community, a world of care woven into the landscape with the goal of bringing all the expertise and resources of modern healthcare to where you are.
And so I know we're running a little short on time, so I want to keep us moving forward. We could talk a lot about the actual hospital design, but I think we've kind of given folks a good idea of what the hospital looks like and what some of its makeup is. But I want to give Allison a chance to talk about how we started to transition from the story that we were telling and the physical thing that we were building into what was the actual experience that we were creating? How do we take this idea and take this shell and this model and really build an experience around it? So Allison, I'd love for you to jump in and talk about some of this experiential work.
Yeah, so like Dave said, along with defining that story that was very powerful for the team, helped unify how we're talking about the new experience in the new building. We were also tasked with amplifying the experience that they were building. So in the renderings a couple of slides ago, you saw some indication of new technologies being put in place, these very beautiful spaces that are kind of inspired by the community, inspired by the local architecture in the region, and even some notion of some of those connected services that they were building into the idea of systemness, of when they were going to be sistering with their other facilities and what the needs of that would be. So this really outlined for us the need for characterizing types of experiences that could bring this story and this vision that they had to life. That's how we approach experience design at Monigle, is along with developing that strategy, that overarching story, we then take that strategy and translate it into something a little bit more actionable. So we took the value proposition that Joyce read through and we made it into 5 words, which was that this experience and this building and this, this entire project is built to last. So it's really important that people understand that this is sustainable, that this new format is actually the future of healthcare. So there's that innovation part in it, but that equally as important is that it's for Lockport. It was built for this community specifically. It's going to be staffed by people who are living in this community and have grown up in this community. So it should feel like home there. It should feel very friendly. So along with that concept filter, we build out these, what we call experience principles. Those are tied both to that future vision, but also built upon kind of what they're doing today. So we had these 3 principles. The first, innovating healthcare. There we're looking at experiences, tying it to the existing experiences that are modern and innovative, and also thinking about how we can build upon that. So a good example of how they were already doing that is thinking about putting telemedicine in every room to connect to each of their, to their system and to all of the providers that they offer. This idea of orchestrating seamlessly is also super important for systemness. So experiences that get patients to the right medical care quickly. If you had a chance to be in on all of the meetings that we were with Joyce, you'd hear her tell the stories about this and how, we wanted to make sure that we can get people into the right care at the right time and as efficiently as possible. So that was really important to us to kind of help them figure out. But even within the existing space, they were already connecting things through putting provider and nurses stations right next to each other. So even within the building, thinking about how they were orchestrating seamlessly. And finally, this idea of building community, that's that for Lockport part. So the location that the actual land plot that they chose within the community had a lot of meaning to that community. It was a well-known apple orchard in which they were keeping that running to some extent, as well as building into a community room for the community to use, which was one of the big things that we helped take on with them as well. So the second piece of the puzzle that we often do for these experience design projects is map out what the experience and what the, I guess, features of the experience are across the end-to-end journey. So everything that you see in black with a check mark next to it is stuff that they were already doing, that was delivering on this vision and delivering on this story. And it was kind of above and beyond what we would maybe expect from this kind of format. And then everything you see in orange were enhancements to that experience that we suggested. So we really kind of looked for those holes and those gaps within the existing experience to add in, a level of service or a level of additional storytelling or even some additional programming that could kind of round out and meet their vision for that future experience.
You want to talk about a couple of the different experiences that we really focused in on?
Yeah, so this again is going to roll through a lot of them, so I won't always be talking about the one that's on screen, but this experience ambassadors was something that they were introducing, as many are, digital check-in and kiosk style check-in and even the ability to check in, through an app. So we had identified the need for this experience ambassador, and that's that human service solution that helps walk people through, that helps guide people into the experience. At the very table stakes, we said that we needed to do that. But in addition, we thought that those experience ambassadors could also start to tell the story of some of the architecture in the building, how the crosses in the ceiling of the lobby are representative of the locks that are very unique to the Erie Canal. So all of those things, they were both trained in helping people use the experience as well as helping people feel comfortable in the experience. So that was a big thing that we looked at. We also helped, and I kind of alluded to this before, with what we called a seamless transfer experience. And that was helping identify identify and define the flow that a patient might take if they needed to be transferred to another hospital. But in the work, we went above and beyond and thought, this isn't only about the patient getting transferred. Obviously, that's the most important part. We want to get them to the right care as fast as we can. We want to make sure that the staff across the hospitals are communicating effectively. But we also thought about the loved ones that were with that patient. What is their experience? How are they being greeted in this moment of potential anxiety as they're traveling from point A to point B? So we actually identified the need for a specific parking spot at that other facility that they could park at, they could be sent, they could easily find, and then be going in the right door to talk to the right person that was already expecting them. So thinking about all aspects of that transfer experience. And then finally, I'll talk about a little bit about the health and wellness programming that we worked on with the team to take that community room and help outline how they might use it to make it as successful as it could be, and to invite the community into our facility to use our facilities, when they want to, not just when they have to. So the team did an excellent job taking these ideas and these experiences that we layered in and kind of running with them.
I'd love for you to double click on that idea of, taking these ideas, which are beautiful watercolor drawings and strategies. What was different about this team and how they took it into action?
What was really different is that literally the day we presented the final concepts, and you'll see that like kind of illustrative journey, which we call a future vision map. CJ was like cutting us off, like, oh, I know who can do this, and I know who can do that, and this guy needs to be involved, or this woman is going to really help us with that. So he was already starting to build, which is the natural thing that we often have to tell clients to do. He was starting to build task forces around each of these ideas, and prioritizing which ones were the most important. So he was already building those, and even within the week, we were briefing full project teams that he had put together.
I would love the Catholic Health team to talk a little bit more about the experience ambassador piece and just some of the work that you did to actually make some of these experiences come to life.
So when we originally were designing the space, we had obviously all these kiosks, and we had an area that is behind the kiosks that's a little bit more private, more of that traditional feel that you see when you register in a lot of our other sites. But one of the things we talked about from day one was how we would greet people then they came through the door. And you think about, you walk into the doctor's office and there's that glass wall. And we had originally said, you know what, we want people to stand up when someone comes through the door so they feel like they're welcome. But our registration team quickly learned that, there were people that were very comfortable using the kiosk, but there were others that were not quite as comfortable using the kiosk. So they started, they put things on wheelies, and the lobby is filled with all this beautiful seating. And they actually greet the patient at the door now. And it's no matter what time of day or whatever, you're greeted when you come through. And they will sit down in a comfortable spot with an individual, take them off to the corner, get the information that they need, or they'll walk them over to the kiosk because we have a lot of people that are repeat coming in for blood work or imaging. And they go over and they do that with them. But it is just a completely different feel. And, CJ and I have taken politicians and different leaders through this building, and they walk in and there's these people that are just waiting, and we turn to them and say, this is not for you. This is for everyone that walks through our door. In terms of the community room and some of the work that we have done there, we have Tai Chi classes. We, instead of using this space really, could have easily just become a Catholic health place that we gather. We have opened it up to the community, and we have a full calendar, And we have groups that meet here from the community. People from the Y come. There's, nutrition classes. There's the Tai Chi. The place is bumping all the time, and it just brings people onto the campus. And it's not necessarily Catholic Health that's doing it. It's other organizations that we have now partnered with that are utilizing the campus as a place that they can bring people, which is really, really wonderful. And then there's up here, you also got to see the Heritage Wall. The Heritage Wall is beautiful. Lockport is filled with so much history. And what's really neat about it is not only do we share some of the heritage of Lockport, but there's beautiful photos in that are hanging down the wall. And that is right next to also our chapel, because we are a faith-based organization. But even the religious artifacts that hang on the walls, we were able to obtain, for example, the crucifix out of a church that used to be in Lockport and is no longer there. But people that come in recognize it and say, oh, that used to be in my parish. So we really took a lot of time and put detail in. And with this heritage wall, there's actually a QR code, and you can scan the QR code and you get to watch this beautiful video that's all about the community. So just beautiful touches that I don't know if we necessarily would have thought of them without the team from Monigle really encouraging us to do things differently.
Well, and y'all did so much differently. One of the things that also really stood out as you were getting ready to open this new hospital, you said, well, we need all of our new employees to think differently and to behave differently and to adopt this different mindset for actually making this work. So, you reached out to us and said, hey, can you help program an entire week-long orientation? And I was amazed at the fact that you were going to take a week to actually dedicate to bringing these people together, familiarizing them with the hospital and the new way of working. So I think that orientation was incredibly powerful. Anything there, CJ, you want to just talk about real quick?
Yes, I think that the key point was we had an opportunity not to try to change people, but to start new. And we spent a lot of time picking the right people. We wanted to find people that could get excited and be pioneers on this journey with us and would not be stuck in the old way. So I really think that the week long made a huge difference. We used DISC evaluation to select the right personalities. We even did simulation, multi-specialty. So we had the housekeeper in with the nurse, in with the dietary person, and they were helping a patient in a bed. So everybody got to see we had to be a team, and they were all going to work together to take care of the patient. And it just was transformative, I believe.
Agreed. So, we can get to the point. This hospital is built and it's open. It's been open for a while now. Maybe tell the audience a bit about how it's going and what you're so proud of.
One of the things I think that's really important to remember is we had a group of people at Eastern Niagara, and many of them came to work for us. They really went through a mourning phase. I mean, we honored Eastern Niagara and the community having to say goodbye to that hospital, and then welcomed them into this new location. So we did things like we had an open house and a giant tent outside, and the community came and we let them walk through the hospital before, we were seeing patients. Another thing that we did was that lobby right there that just popped up. Before the hospital opened, we had a giant farmhouse tables put all the way down the entranceway. And we invited all of our leadership team and the people that worked on the hospital, and we sat down to dinner in the lobby, knowing that we would never be able to do anything like that again. And we recognized, the hospital presidents and the nursing leaders from our other sites who may not have been involved in the day-to-day of the planning and all the work that was done, but we really wanted everyone in the organization to know this is our hospital. It's not Joyce's, it's not CJ's, it's Catholic Health Hospital, and that they were very much a part of it as well. That was just a really beautiful event. I will also tell you, we did the same thing with our construction workers. We brought them a book to sign so that they could write down the memories, because many of them lived in our community, and this was one of the biggest projects they had ever done for their community. And they were so proud to be able to build a hospital that was going to stand there for years to come. And we put that in a time capsule. But it was just embracing everybody and bringing them in. I think the biggest thing that has happened, we anticipated probably seeing about, what, CJ, 40 patients a day. We see over 70 patients a day in this site. This location was so badly needed in the community. When we opened up primary care, the panel filled up just immediately. All the specialists that we brought on to the site they're busy, and people are really understanding that we didn't build just a fancy immediate care. We built them a true hospital. And one of the greatest things that has also happened is people are starting to realize that care in this country is shifting, and that every hospital cannot be good at everything. And you can't have all services at every single location and do it well. And I think this hospital speaks to that, we take really good care of the patients that come through in an emergency room and those that remain on campus. But there are times when you need to go to a tertiary hospital, or you need to go someplace else to deliver your baby, because that's the best and safest place for you to go. And I think this community is really learning that now, and far more accepting of that. I will tell you, our competitor is going to be building a hospital in another more rural community south of here. New York State has told them, they took drawings and they were told, nope, that's not what you're going to build. You need to build what Catholic Health built up in Niagara County. So I think our hospital has also become a model for our state, as a really innovative and great way to provide good quality care, especially in rural communities. CJ, anything else you want to add to that?
Perfect, Joyce.
Okay.
And in the interest of time, we'll open it up to questions. And I think we've covered these 3 points on the screen, and I encourage people to read them. But any questions from the audience that you'd like answered? There's a couple that I can see. Are the ambassadors volunteers or hired employees?
We initially thought that they were going to be volunteers because Eastern Niagara had a nice women's volunteer group, but you can't always count on them. They're not always, maybe the best at delivering the kind of care, the kind of experience that we wanted. So we were going to have a whole separate team, but then the registrars that we really didn't think they were signing on early on just stepped up. They did this themselves. And I go back to, we picked the right people, we got them excited about it, and they were the ones that when I first saw them sitting on the couch, I said, oh, no, this is not the way we do it. And then I go, no, we're part of this community. They're coming into our home and they're sitting on the couch, and we're going to take care of them. And so, yeah, they're our registration staff, believe it or not. They're the ones that are usually sitting in the desk in a cubicle somewhere. They're out right in the lobby.
Not a question, but a shout out from Amy, who is a native Buffalonian. So
Go Bills.
Can you all talk a little bit more about all the different types of community listening sessions that you did? I know, like I mentioned, we did a lot of interviews and talked to a lot of different people, but I think it's important for people to recognize how much the two of you are honestly out in the community just talking to people.
You want to start, Joyce, and I'll fill in?
Yeah, when I talk about that this community likes radio, I think we were on the radio at least every other week. It might be CJ, it might be myself. We actually had some of our physicians go on the radio, and it was a talk show, so people could call in. That was a big thing. We spent time with the fire departments, all the local volunteers, all the EMS. Those were valuable conversations because they really were thinking about how they would get an ambulance to the site. Could we open up another entranceway? They gave us wonderful feedback, but they were skeptical in the beginning. Again, thinking that it was going to be a glorified immediate care. And I will tell you, the day that we opened, they all had a bet who was going to bring the first patient to the new hospital. So they definitely changed their tune. Elected officials, the Department of Health, the local Department of Health. Like I said, we would go to the farmers market with the drawings, and people would just from the community would walk up, look at the drawings, ask questions. Anything where we could engage with the community at the Y. A lot of different, women's groups. Anywhere there was gatherings, we tried to have somebody there so that we could give good information, so that people didn't make up their own story. CJ, anything else that?
Yep, we sponsored some of the local plays in one of this beautiful old theaters. We were on television a whole bunch too, Joyce, and newspapers. They were really interested in what we were doing and how we were going to fill in and support that community. So we got a lot of great coverage. And I have to say the common message that Monigle brought to us helped enormously.
One other question about digital tools. What kind of digital tools and maybe even analytics were used in developing the model and operating it?
Joyce, you want to talk about the telemedicine stuff we built into all the rooms?
Right. So one of the biggest expenses, obviously, of running the hospital is you've got your physicians that are covering your ED, but then you have your hospitalist groups. So we built a very different model by using telemedicine, and our hospitalist group will actually round through telemedicine, and that's been extremely effective, especially late night admission or where we need them quickly. We can get them through telemedicine. A lot of the equipment, there were things that our nurses weren't used to using because somebody else did that work. So we retrained the nurses on how to do different things, and we made training videos available so that they could access those. The telemedicine also can be used to engage with families. So literally you can do, a FaceTime with the daughter in California so that she can check on her mom while her mom's in the hospital. Outside of all of our rooms, we have, I don't know what you call them. They're electronic,
They're like small little iPads.
Yeah, they're like screens. Those screens are different colors based on, is somebody at risk for falls? Is this an isolation room? So rather than writing things out, things are color coded on the screen so nobody really knows what it means. If the room is not occupied, our mission, vision, and values come up on the screen so that those are constantly visible to people. We also have electronic boards in the rooms. Families can, literally leave a message on a board. We can, the old whiteboards that you have in a lot of rooms, these are all electronics. They're electronic whiteboards. So anywhere we can utilize technology and make things better for people, we're definitely using that technology. In terms of modeling, and when we were building this going to build the building, as CJ said, we used an outside group to actually help us with developing the modeling because it was going to be, it was pretty complex. But in addition to that, we hired a firm that came in and did an analysis of the marketplace when we were trying to determine the number of beds. And part of it was done through population study, but also because we were working so closely with Eastern Niagara Hospital, we knew on a daily basis how many people were coming into the hospital, how many admits that they were having, the types of patients. So that really helped to guide us to know what type of patients we would expect to see come to this site as well. That relationship with Eastern Niagara was so critical. We learned so much from the way they operated on a day-to-day basis and the ways that we weren't going to operate on a day-to-day basis in some instances.
I think the only thing I would add real quick is that the technology allowed us to keep patients in their community. About 2 or 3% of the patients that come to that location need to be transferred to a higher level of care, because we're able to we brought the specialists into the community, and then where we can take advantage of telemedicine, we're trying to do that to avoid the trip during a big snowstorm over 2 bridges through Grand Island. If you know the territory, it's a little treacherous sometimes. So that's worked out really well.
Well,
We
I
had
just want to say
we had a
thanks to.
beautiful helipad right outside the door.
That's right.
Yeah.
Just in case.
I just want to say thanks to Joyce and CJ for spending the time with us telling the story, and Allison and all of you for joining us and listening. If there are any questions, please follow up. Judy, any final remarks?
Thank you, Dave, and thanks to everyone who's joined us today for this really inspiring discussion. Please give us your feedback by completing the evaluation survey as you exit the webinar. And I hope to see all of you at future forum webinars, as well as at the Healthcare Marketing and Physician Strategy Summit, April 29th to May 2nd in Orlando, where Monigle will have 2 more inspiring and eye-opening sessions. That concludes today's program. Thank you and make a great day.